The Department of Health is observing Pregnancy Awareness Week starting today until Friday. The focus is on enhancing education around healthy pregnancy and ensuring the well-being of mothers. For more on this conversation, we are now joined by Kefilwe MmaBotsetsi Sibenya, a trained birth doula. Kefilwe, thank you so much for your time and for joining us this evening. So between the 10th and the 16th of February every year, the Department of Health hosts the annual Pregnancy Week. What's the theme for this year's Pregnancy Week?
So the theme currently in South Africa is thoughtful birth, and we have different themes globally, but currently in South Africa it is thoughtful birth.
And with this theme, Kefilwe, thoughtful birth, what are you trying to convey to mothers, or what's the department trying to convey to mothers with regards to thoughtful birth?
Well, my role as a doula, I'm trained to provide emotional, physical, and educational support to birthing families or birthing women in our country. So my purpose is mainly just to help women have a safe and memorable and empowering birth experience. So focusing on the theme being thoughtful birth, my role as a doula would be providing women with the right to choose their birth companions and providing them with emotional support. And that simply just envelopes the role as a doula in the birthing space.
Speaking of being a doula in the birthing space, maybe let's take it into the context of the public space. So if I'm a mom and I want to give birth in a public hospital, is there access to a doula, and would I be given that option of having a specific partner who would assist in that birthing process?
Look, currently in South Africa, doulas are advocating for women to have the right to their choice of birth companions. And it's not all birthing facilities that allow doulas. So not all birthing, both in public and private facilities, not all facilities are doula friendly. So we collectively have formed partnerships as doulas to try and bring the information to the public, to be able to advocate for them, and also to be able to explain what the role of the doula is. Because in some instances in communities, they cannot differentiate between the role of the doula. Doulas do not replace family members. Doulas do not replace their partners. Doulas do not replace fathers. So as a doula, personally, my work has been informing women in my community about my role and also preparing them through birth preparation in case the facilities where they give birth are not allowed to have doulas present or birth companions. That is the challenge that we are currently facing in the country, because the role of the doula is not regulated and is misunderstood.
So the role of the doula, like you're explaining, is in the pre-birth space. It's when the mom is giving birth. What happens after baby is born? What role does the doula play there?
So the doula, can I give you two examples? So
yes.
in the private sector, I spend a lot of time volunteering in the public space that obviously allows doulas to be allowed to work in that space, where we support moms for what we call the golden hour, which is the postnatal, the first hour where we try and initiate breastfeeding, because there's a misinformation about women understanding or being able to breastfeed immediately. So we are there to offer the emotional support and physically also try to support and teach moms about breastfeeding.
You mentioned earlier that the space of doulas is not regulated. If it were regulated, how do you believe it would have made it easier for you and better for birthing moms to be able to access and have sort of the advantages of having a doula present during their birthing process?
Well, my personal view about the space being regulated is that as doulas, we spend so much time trying to advocate about our role in the space, the medical, because we're offering non-medical support. So in many instances, you find that the maternity space, they have no idea what we are there for. We are not there to replace, or we are not there to, because I found myself in a space where there's lack of resources, and you'll find that the maternity team does require hands-on support. So by regulating this space will enable us doulas to be able to confidently support moms in this space, and to collectively be able to move forward about what the role of the doula is. And also to be held accountable about the information that we are sharing with the public.
You mentioned earlier on that you function mainly in the private sector space. So which type of moms currently are making use of doulas?
Look, Katleho, it's so unfortunate that currently the women that have got access or that are using this resource, I call it resource because we are just there to I'm trying to find the word. We are just there to, we're just part of the birthing team. But I find that women that are having access, women that I have supported in the private space, is women with medical aids. We do have medical aids in South Africa currently that recognize the role of the doula, and women do have that benefit. And in the private sector, those are the women that we are currently supporting.
In the public space, we often see maternity wards would be overcrowded. There would be a few number of nursing staff that would be able to assist some of the moms that are giving birth at that particular time, because they are inundated with a lot of the admin work and prescribing certain medication during that time. Do you believe that having doulas in that space, given our current health system, that it would work or assist in any way?
It would, definitely. It has proven that it has currently worked. Unfortunately, I cannot name the facilities where doulas spend most of their times volunteering, but we have been well received in certain facilities, and it has worked. Definitely.
In this being Pregnancy Week, what do you think are some of the things that moms miss out on, or questions they don't ask in them having the correct birthing process in the prenatal stages of their pregnancies?
Look, one of the biggest challenges that I have seen as a doula, doulas, we are not allowed to, our scope of practice is quite limited. So what we do is we prepare moms physically, for the birth, but the information that they are given at antenatal care level are within the maternity space where they are receiving the care. So I find that the gap here, the challenge is that women do not book for antenatal classes. Women do not disclose a lot of information because they feel that it is not relevant, and they do not feel safe in that space. I have found that not providing the adequate information during antenatal care does have a dear impact on the birth outcome for the women that we are supporting in the public space.
All right, MmaBotsetsi, thank you so much for your time. We certainly do hope that you will continue in helping those moms during that birthing process and after their children have been born. That was Kefilwe MmaBotsetsi Sibenya, a trained birth doula, speaking to us there as we start the week of Pregnancy Awareness Week. Let's take a quick ad break. We'll be back with a few more stories after this.